So this is the patient we're going to do today. This is the CC projection. This is the MLO projection. The lady has an area of asymmetry, which we worked up and is okay. But what we're really after are these little calcifications. And on the lateral, this is the MLO projection. They're sort of behind the nipple, and there's some smaller ones and some more clumped ones. And then on the craniocaudal projection, they're just a little bit in the inner aspect of the left breast. Again, this is a new cluster of somewhat pleomorphic calcifications, left breast, 10 o'clock. Since we're going to use the add-on system to the digital unit, we can go from medial or we could go from the top. So we've elected to try the CC from the top. The patient will be sitting and she'll be in compression in the CC, and the biopsy device, which you'll see, will come right down, not near her face, but next to her face. So the next thing we're going to do now is get consent from the patient.
A Bella blanket is placed over the unit, and the chair is draped. The Mammatome Revolve ST probe and vacuum set are removed from the sterile packaging. The probe and vacuum tube sets are plugged into the control module and are attached to the ST holster. Tubing is connected to the canister and saline. The control module is powered on. Procedure initialization begins.
So you do this for every case before the patient is ready, is that correct?
The holster side is selected, and the machine is put on standby. The patient is positioned in a craniocaudal position with her left arm down at her side. Compression is applied against the left breast. The first series of scans are taken.
So this is the first image. This will be our scat image. This is the area we're after, and it's absolutely perfect. So we're just going to center it, just like you would center it with the prone table.
The first scan position is marked, and the breast is slightly repositioned and compressed.
Okay, so the next thing we're going to do is, after we reposition, we're going to take another scat image. So we're going to get our two stereo pairs now. We got our two stereo pairs, plus 15 and minus 15, and now I'm going to target. Here are the calcifications, going to target right on them. Okay, so now we're going to pick the needle and puncture that we need. And we're going to use the 10 gauge, 19 millimeter. Okay, so we did that. And we're ready to send it, and the target's ready to send. Okay, so the depth is 35 millimeters, and our compression is a little over 40, so we're okay. So we're going to send it over to the stage.
The site is prepped.
The next thing we have to do is put on this bushing, a little bit of local in the skin. And you're going to see a nice skin wheel. And we're going to increase the depth with the local. And I'm going to go in a little bit deeper. So we're going to go real slow. And we're going to tell our patient we're going to give her more local. And this, you really have to have patience because you don't want to push the calcifications. So I'm going back and forth giving the local.
The probe and holster are locked into the probe guide holder.
I'm going to turn the clock so that this is at 3 to 9, and I'm going to go back one more time, make a little nick, and now I'm going to make my skin incision. And I'd rather be too small than too big to begin with. Okay, so we went in, and now we're going to go to Z0, and we're going to take our images pre-deploy. We're taking the minus 15 degree image first, and we'll see where we are here. We're heading right for the calcifications. So this is the pre-deploy. You never cheat. You always take your pre-deploy and your post-deploy. Yeah, so I'm going to activate this side. Okay, so it's activated with the blue light. And now I'm going to deploy the biopsy device. So I'm going to tell our patient it's very important not to move. She may feel a little bit of pressure. Okay, so this is the safety, and this is what deploys the biopsy device. Okay, so I put the safety on, not to move, not to move. And there we go. Now we're going to take 2 more post-deploy images. Okay, so look, the calcifications are right over the bowl. And we're ready to go. I'm going to just put the clock at 12 o'clock. And the way we do it is I go even or odd and not even, so I like to go around, I'll take 11 or 12 samples. Here we go. Whoa. Okay, the samples are coming in upstairs here. Okay, we're almost halfway done. And you can see the samples coming in. And I'm just holding the button down and moving the clock. So now I'm starting on the odd numbers. We're just going to vacuum once. And then I'm going to dry tap. Then we're going to close the bowl. Okay, the bowl's closed. I'm going to take off the top. Okay, so here we're going to take the samples out, and then we're just going to put it down here and flatten this out. The numbers are radio opaque, and where the specimen is radiolucent, so nothing is being hidden. So we're going to pull this out. Samples are coming out. Lost one, but we're going to put it down like that, and see there are no more samples in the slots, and now we're going to x-ray them. And you can see on specimen number 5 and a specimen number 6 and in specimen number 9 there are these linear calcifications. So it's pretty easy now for us to take the specimen out of the container, out of the slot. We know 5, 6, and 9, and we separate our specimens into calcifications, no calcifications, and we don't have to handle the specimens.
The specimen are separated into containers marked with calcs and with no calcs. The aperture is open to 12 o'clock, and a marking clip is placed at the site of the biopsy. The probe is retracted.
After we got our specimen, we put in the clip, and you always get post-clip films, and you get a craniocaudal film and a lateral film. It's really non-negotiable unless there's a severe bleed, but we have to see the position of the clip as it relates to what we did. So here, this is the bow tie clip. It's in perfect position. Remember, the calcifications were a little bit inner, and if we look at the next image, the lateral film, it's a little bit upper. So the clip is in exactly perfect position, and the patient's done. And now we're going to wait for the pathology.
Pressure is applied to the incision site. Steri strips are placed over the incision.